second quarter, we say, well, now let's connect this to your clinical work. Okay. Let's do another paper, but this time bring in a video if you can of a clinical session that you had, a little segment, okay, and we want you to select something, an encounter with a client where you say, there is my signature theme. Something was triggered for me, okay, something came up for me in that experience that had to do with my own experience. One of the defining pieces of what the person, the therapist model has to do with is that we're not just dealing with triggers, we're also saying to them, hey, actively, purposefully use, what your own life experience is in order to accomplish your clinical task of relating, assessing, and intervening. So there's an active use of self, not just a passive use of self. So we have students present a clinical vignette, and we use that as a way of helping the student to recognize me in that clinical encounter. We also give them the option to do a role play so that we can get other students and have them role play a couple, have them role play a family, and then they'll be supervised live, and as something happens between them and the client family, okay, we'll stop and say, stop now. What are you experiencing? What comes up for you? How can you use this now in your the next thing that you do and say with the families?
And it really makes it come alive for them in the moment.
Okay. So what we're trying to do then is help them to begin to bridge the personal with the clinical. And so that's in the second quarter. And then the third quarter, the spring quarter, then we have paid actors, and they're trained to do the client thing.
That happens in our simulation lab.
In the simulation lab, we have a studio so that the student then goes in there, sits down with the actors who are really quite good at portraying a client family, and they really get into it. And the student has a bug in the ear so that I can then talk with them and supervise them and also call them out, okay? But so that we're then giving them an experience that's very clinical, okay? But of course the supervision is going to emphasize, okay, what does this trigger for you? What does this bring up for you? How can you use it? What is it in your own life experience that can help you to better relate to, connect with your client, to better intuit what your client is thinking and feeling, okay, and to get a better sense of how do I implement my intervention in such a way that the client experiences that, okay, this is what I want to do, and this is what's difficult for me, but this is what I want to do, and this is going to help me, so that they accept it. Okay, all of it having to do through the intimacy, okay, of the connection between therapist and client. So they have a very clinical experience in that last quarter. So by so as I see it, we're setting the foundation in the training, okay, for them to then make use of all of the technical training that they're going to get, and say, or I can take that into who I am, so that when I go in there and sit down with a client, okay, it's going to be an experience of a very well-trained, technically well-trained person whose abilities have now come to life through my own life experience.
And that's an important piece when you talk about the foundation of their training, because one of the things that the faculty at Drexel wanted to see happen is that we wanted this to start at the beginning of their clinical training, so that they were learning this as they were seeing clients, as opposed to in the middle of their second year when we introduced this concept and they would have to unlearn some things. So so that was key for us. I would like for you, I'm curious if you would just talk a little bit more about how you talk about confidentiality within the group. That first, when the students are beginning, they talk about their own personal material, and things that you do around confidentiality when they start to show video clips.
Well, if they're going to show video clips of clients, I mean, this is, they have to get written permission from the client, and a permission that's quite explicit about this is what we're using this information for supervision.
Right.
Okay, we're not going to be showing it anyplace else, and also if you don't want to be videotaped, you can refuse it. Doesn't affect our relationship or the work we're going to be doing.
Right.
So that's very clear. But we also have a document for the students. Okay, that says, you know, this is going to be an absolutely safe place for people to present what they want to present. We're very clear with the students, by the way. I say to them, you know, you present the part of you that you want to present. Things about yourself you don't want to bring up, don't bring up. Okay, so don't go bringing up anything that then you're going to regret having shared publicly. I don't want to hear it, and the students don't want to hear it.
So they have control.
Total control of that. Okay, but then the document that we have the students sign is one that says what you hear about your fellow students, okay, stays in here. Okay, and is to be treated the way you would treat client information. You don't go sharing it with your buddies outside. And in fact, we ask that they not discuss what they hear about their fellow students with the fellow students unless the fellow students wants to talk about it. Okay, so that you respect their privacy. Yes, I talked about it with the instructor in front of you guys. I really don't want to get any deeper with you about it. Okay, that's in writing. That's quite explicit in writing, so that this is to be a safe place for us to be able to open ourselves up.
Right. And that's really great that that goes along with the safety piece of it, and what I hear from our graduates, it's one of the best experiences they have in their training program that really helps them along the way. How does I think that anyone that's viewing this would be curious about how students, I guess, react to the process when you're explaining to them that this is what we're going to do and this is what we expect, and this is how it's going to impact you.
Well, you know, we explain it, and they panic. They say, "You must be kidding! I'm going to talk about this stuff in public," but they very quickly catch on that this feels quite safe. What we what I did not anticipate. Because I'm so focused on the bottom line, you need to become a better therapist. This is to help you to be a better therapist. Let me just put one sentence in here. Okay, this is not model related. So, you know, so this is foundational, and then you can go wherever you want to go in terms of what therapeutic model you want to work with. Okay, but what we had not anticipated was the personal impact it had on people's lives. You know, and I keep hearing from students, they say, you know, this has changed my life.
And it's not therapy. We're clear about that.
This is not therapy, you know, and it's never presented as therapy. It's always focused on whatever you learn about yourself, how does it translate into how you do better therapy? Okay. Well, but we know, you realize, you know, we're right at the very entrails of what the process of therapy is about. You know, because the whole transformational experience of therapy is a knowing of yourself and an acceptance of yourself in such a way that says, I don't have to protect myself from me. Okay, I can look at these things, and I can do something about it, because we're looking at it, what you can do with this, and I can't do this by myself. You know, I have my instructors supporting me, I have my colleagues supporting me. Okay, and so what in the end we're saying to the students is this self-exploration, this work that you're doing on yourself, it clearly implies that you have a commitment to working on yourself. Okay, that you don't just sit down and say, okay, this is who I am, too bad. Okay, that you're saying this is an opportunity. Why? You have to have that mindset. The why is because when you sit down with your clients, that's how you're going to approach your clients. You want them to say, okay, these are my issues. I can do something about it. And if you don't have that about your own life, you can't communicate that to your client.
That's right.
Okay?
That's right.
Well, so then the side effect, in a sense, has been that the students have said, I've been in therapy, and I've made more changes here than I ever did in my own therapy. Okay? And this has happened repeatedly. And we say to them, wonderful, we applaud it.
Right.
Okay? But this is not therapy. But clearly, it's somehow or another, it is connected to therapy.
Right. For us at Drexel, it was important to communicate to the students that their support extended beyond the course, the POTT course. And so we really needed faculty to be supportive. And one way in which we have done that is to integrate core concepts of POTT throughout the curriculum. We're constantly asking students about signature themes in relationship to those therapeutic models, in relationships to techniques, and what is it going to mean for you to increase the intensity when you're working with clients, and for them to consciously begin to think about these kinds of things. But the supervisors also need to be open to this process. And so I'm wondering if you have any words of wisdom for faculty and supervisors who weren't trained in this kind of approach initially, but are interested in integrating in their programs.
Yeah, well, it's, in a certain sense, it becomes foundational. It becomes part of the soul of the program, so that it needs to be seen as something that permeates
Absolutely.
All aspects of the training. Okay? And so that if people can accept this as this is part of the fabric of what it takes to become a therapist, then you don't have to have conflicts about this model or that model of therapy. The reality is that no matter what model of therapy you work from, okay, it always takes place through the relationship.
And the research supports that.
Yes.
Over and over again.
Well, thank you, Stephanie. It was a
Thank you,
good
Harry,
chance to talk together about it.
for us to reflect on this. Yes, thank you.
So, in POTT, we talk a lot about our backgrounds and about who we are because that influences um, ourselves and our relationships with our clients. And I'm wondering if you can tell me more about who you are and where you come from.
Sure. So, for me, my family of origin has definitely impacted my signature theme tremendously. I come from an upper middle class family, very, very religious, very successful. My sister, I have an older sister, my mother and father together. Father's a doctor, mother's a nurse. My sister is actually a marriage and family therapist. They're all very successful, same with my extended family, and the expectations have always been very, very high. I've definitely interpreted that throughout my life as being something that I needed to achieve as well, and it's really, really, really impacted the way I look at the world and the way I've experienced, my upbringing.
So I'm hoping that we hear more about that as we talk about your signature theme. But
Oh yeah.
can you tell me how you first conceptualized your signature theme and then how that developed over time through the course?
Sure. So the original conception of the signature theme I had before experiencing really any of the training was a fear of failure. Like I said, my family had a lot of expectation, and I had to achieve. I had to be successful, almost to feel like I was loved or accepted. So my original conception was that I had a fear of failure. As I started engaging in the program a little bit more, I realized how surface level that really was. So my theme sort of evolved as I progressed through the system and interacting with the instructors and my colleagues. So I started to realize that the fear of failure was rooted in something much deeper. It became this failure to accept limitations in line with being kind of oppressed by my family. Like I said, they were very religious, and I had to comply with their rules and regulations, even if I felt that they were wrong. I just had to, for that acceptance, and it became for me an internalized like rebellion, and I flipped from constantly being okay and accepting what they wanted from me to being the exact opposite and absolutely hating limitations, restrictions. I had to feel like I was my own person and escape, almost cut off from them.
And so you said that this transformed your view of your signature theme from a fear of failure into, you know, this sense that I feel restricted by other people. And I'm wondering, how did that manifest itself in your relationships and in your clinical work?
So, I mean, in a lot of different ways. So in personal relationships, particularly with my family, any sort of argument was exploded, and it was just like I was unable to ever connect with my family members because I would immediately respond in really negative ways. It's probably better to say that I reacted without thinking.
Okay.
I just felt like they were stifling my self-expression, my autonomy, my selfhood. So in reaction, I would always kind of go haywire. I get so anxious when I feel like someone is taking away my personhood, and my family of origin, obviously, I would say has done that the most. Beyond that, in clinical work, it's definitely translated very negatively until I started to understand what exactly it was.
And you talk a lot about this concept of low differentiation and how that has really sort of embodied your signature theme and your experience. Can you speak to that a little bit?
Yeah, I think the next step in my my signature theme evolution, I guess, would be we went from this inability to accept limitations and restrictions to what became understood as a low level of differentiation, and that's exactly what it is. I can't tell where my emotions start and where other people's start, really. So with my family, for example, I would feel so overwhelmingly restricted because I couldn't separate their understanding and beliefs from my own. I felt like I had to have them, and I experienced them so deeply. And so my different level of differentiation was horrendous until I entered this program and learned about it. Now, for example, in my clinical work, I'm able to recognize, like, I feel the emotions of the other of my clients, and at first they would become overwhelming, as if I was talking to my mother or my father, and I would get lost in this haze of anxiety and feeling like I was being restricted by them, which now really doesn't make sense, but it was the experience in the moment, and it muddled my ability to reach them because I couldn't even manage myself.
Well, and I'm just struck by the fact that this is a huge realization. And I'm wondering what aspects of the course allowed you to get that information about yourself and then be in a place where you felt like you could use it clinically.
It was a struggle. It started off, I had a really hard time being vulnerable throughout the process. Presenting like, oh, this is what I think is my biggest problem was not an easy thing to do. But the instructors worked with me calmly and were patient, asked me the right questions and kind of pushed me through. And then I was able to kind of, in discussing with my colleagues afterwards, and actually seeing their presentations as well and watching them become vulnerable and kind of go through this process made me more comfortable in doing the same thing. I realized that there's something to this in watching other people and watching them kind of grow. and it allowed me to open up and do the same. And then the journaling process that's involved allowed me to take a step back afterwards, after I've processed my experience and the experience of others, and really think deeply about what was going on for me, and write it out and think through it and connect it to clinical work, connect it to past experiences, and it really brought to life what these issues are, and also allowed me to kind of conceptualize how to fix it, or how to improve it, or what needs to happen. It's really helpful.
So that pattern of experience, step back and process, experience, step back and process has been really influential in your development, and you really got some good insights about who you are as a person. And so with that said, I want to move on to your clinical work. Can you give us an example about how you use yourself to work with a client, either through the relationship, through the assessment, or actually intervening?
Yeah, absolutely. There's actually a recent example I can think of. So I've been working with a mother and son for about 6-7 months now, and the son was removed from her care. She's got issues, I guess, maintaining emotional stability, affectual stability, kind of a manic sort of person. And her son was removed from the home and has been staying in foster care for the 6-7 months I've been working with them. And I had a family session with them, both of them in the room, and the son was trying to express himself, disagreeing with the mother, trying to say, like, no, I don't feel this way, I feel this, I've experienced that differently, I want to tell you why. And the mother, in her kind of mania, tangentially just going down all these rabbit holes, talking over him, discrediting his experience, almost taking away and invalidating his emotions. And you could see the kid. I was sitting there and I was getting so irritated along with him. I saw the boy and just saw like his affect change, him getting really upset, almost to the point of tears. And I was like, wow, I was right there with him. It felt like I was at home with my mother, just having her take away my experience. Didn't allow me to have my own emotions and express myself, almost like they didn't matter.
So you really related to this kid.
Oh, yeah. And from there, I normally, like, before this experience, I would have just been like so irritated. I would have responded. I probably would have sided with the kid and really lost touch with what was happening, almost be combative. But I was able to recognize it in the boy, check myself, realize that I was having the same experience, this countertransference, but then access it, regulate it, and use it to kind of talk to the mother to say, like, I think he's experiencing, something that I felt I was experiencing. And it wasn't helpful for this session. And it required a little bit of redirection. But in talking to the mother, she was able to kind of pull back and recognize that she was sort of stifling her son's expression, and that it was important. And she was able to sit patiently and start to listen to him. And he brightened up and he was like, thank you. He was appreciative, and he was able to voice his experience, and the mother was able to receive it. And it was through kind of regulating myself that was able to happen. And it would never have happened prior to this experience.
So it's not the fact that you didn't feel frustration in that moment. It's the fact that you were aware of that frustration and used it to relate to this boy and to do something different.
Yes.
So it wasn't something that got in your way at that point. It's something that you accessed and used in the session.
Yeah, I feel like the purpose almost of this training is to access like your own wounds, your own issues, to recognize it and not see it as such a negative thing, not something that's debilitating, but finding that awareness allows us such great personal growth and access to the emotionality of others and understanding, self-understanding, and using that self-understanding and regulating my own emotional reaction, especially when it's shared, I feel like in the room, really allowed me that access